All right, thank you so much for joining us today. My name's Emily Sprenger. I'm an academic trainer in the Center for Teaching and Learning, and I'm very happy to have one of our own alumni come back today, Dr. Jason Walker. Thanks so much for joining us today. We are going to be discussing research in real time today. So a couple of housekeeping pieces. Have conversation in the chat. We welcome that. Questions in the Q&A, please pop those in there. I will get to them as time permits or as Dr. Walker pauses throughout the presentation. And then the other piece is, remember, we are recording this webinar. As always, I will post it in the CTL webinar LibGuide page. And one tiny piece here, we are scheduled for an hour and a half. We may go that long. We may go a little bit shorter than that. So feel free to hang with us throughout the presentation and ask questions and engage with us as we move through this presentation. So I'm going to turn it over to Dr. Walker.
All right. Thank you.
Awesome.
Awesome. Thank you. And good afternoon. I am joining you from Canada, Vancouver, British Columbia. I am an alumni from North Central. I graduated in, oh my goodness, 2017 with a PhD in psychology. And since then, I went back to school. I got a second doctorate. I do not recommend you do that in clinical psychology. And I teach and practice in Canada, the US, and the United Kingdom. So today, I'm going to talk to you about understanding how to implement research in real time. So when there is a practical opportunity to answer some intriguing questions, and I'm going to frame it within an Indigenous context, and I'm going to go into detail around that as well. I'm a professor at the University of Canada West in Vancouver, and I'm also an clinical adjunct professor of psychology with City University, which is part of the national family with NCU. So without further ado, and feel free to ask questions in the chat, and we will get to them. So in Canada, we begin lectures and gatherings and events with a land acknowledgement. So a land acknowledgement, if you've never heard this term, is where we pay respect to the land that we're on. So because in Canada, we are on the traditional, ancestral, and unceded territory of First Nation people. So we say traditional in order to recognize that land is handed down from generation to generation. We say ancestral to recognize that the land was traditionally used for fishing and hunting and gathering. And we say unceded because the land has not been turned over to Crown by treaty or other agreement. So depending on where you are in Canada, on Vancouver Island, where I am today, I'm on the Coast Salish people territory, Malahat Nation, and Cowichan tribes. So a long time ago, and Emily has seen this, so it might not be funny for her, but my mom's like, be brief, be funny, be seated. I'm a professor now. I'm already seated, so I'm trying not to be a complete didactic experience for you today, but we shall see. So if you'd like to get a hold of me, there's two ways there. And just to give you a little bit of background briefly on myself, I started my career in sex crimes and crimes against children. So I spent time as an investigator, and that work was very taxing. That was way before NCU. And back in the day, at the turn of the century, after I completed my degree at University of Toronto, where I did a master's, it was hard work, but we didn't know much about post-traumatic stress. And in that experience for me, after a couple very serious incidents, one in which I was hurt at work, I developed post-traumatic stress. And at that time, like I said, we didn't know much about it. We didn't talk about it very much. And that went untreated for me for a very long time until, of course, I hit a wall and life got very hard and very dark for a while. However, like I tell my students and my clients, treatable, anxiety, depression, post-traumatic stress, hard, but treatable. So in my 22 years now of career, I've worked as a hospital administrator, I've worked in emergency services, and where I've really found my niche is in Indigenous communities, where I've worked for about a decade, and now academia. So today, what I hope to walk us through is an experience I had in northern Canada, where like it's cold. It's like Celsius, because I can't do the conversion. It's like -50 in the winter. Like we were taking snowmobiles places. It was cold. And part of that is going to very remote and isolated communities. And my role at the time was the Director of Health Services. And I was brought in on an interim basis to really relook at how services could be delivered in the North and how we could look at delivering better services, integrated services. But there's a number of challenges, and I'll talk about that, including the ability to get professionals to work in remote and isolated places. So in terms of framing research for the context of research and practice, this was postdoctoral work for me, what I'm going to present today. So I'll talk about why we did the research, the purpose, all that fun stuff, the ethics. But I really want to show, hopefully demonstrate to you how you, once you hit graduation, or even maybe during your time as a student, you have the opportunity to start thinking differently about the world. If you're a clinical student, for instance, you'll start to see the world through pathology, right? In psychology, we break down problems, we assess, and we diagnose. And the problem that we were faced with in the North was a significant suicide crisis. And some of the learning from that experience, we wanted to take a look at how could we inform policy and practice in a different way. So understanding where we come from and what we bring to the table is critically important, especially working, having the privilege to work in Indigenous communities. So I acknowledge that there is seen and there's unseen privilege, being non-Indigenous, being male. And throughout my life, it's provided me with privileges of education, access to health, employment, and other areas of language we use as colonized society. So I'm not an expert at being an Indigenous ally. However, I have dedicated the last 10 years to working in Indigenous community, being invited in, and having elders guide me in terms of my own learning. So the experience that I'm going to share with you today is learning. And it comes from incredibly intimate and personal experience, traditional knowledge. Some learnings I have permission to share with you, and others I don't. So as a non-Indigenous person, being invited to do research with an Indigenous population is incredibly special. As well, it comes with a great burden. So there's this importance of self-reflection, a critical understanding of who you are, what you're bringing, the bias that you are bringing, and also the need for guidance and reciprocity. And this is grounded in respect. It's grounded in respect and trust, and that trust takes years to develop. So when I was invited to work in the North, I understood that I was coming from a different perspective. and that my perspective and understanding and interaction with the world is very different than the reality of which I was stepping into. So I may have been an expert in terms of health administration and psychology, but the application of that is very different when you're on the ground in a community. So in Canada, we have more than 600 sovereign Indigenous governments. So where I work in Vancouver, there's Musqueam, Squamish, and Sabletooth. And they are the traditional land, in Vancouver. But each nation, whether it's in British Columbia, whether it's in Alberta, it doesn't matter where it is, they are an independent government. So working with the government of Canada, the provincial government, it is government to First Nation government. And so what that means is that it's a very complex understanding of how we can interact and how we can gain service. And by service, I mean integrated health services and mental health services. So to give you an understanding of the population of Canada, for those of you that do not know, there's about 38 million of us. The state of California has 39 million people, okay? So we have a big land base, but in terms of when we compare our population with yours, well, we have some catching up to do. And in terms of Australia, 25 million. So of the Canadian population, about 1.67 million, so that's 4.9%, are self-identified as Indigenous. So Indigenous is the fastest growing population in Canada. And it grew between 2006 and 16, which was our last census, grew by 42%. So Indigenous encompasses First Nation, which they either have, some have status, some do not. Métis, people that were born with some First Nation in their makeup, primarily though coming from a more French geography. And then the Inuit people in the extreme north. So just to give you a sense of that, when you look across Canada, and this is actually the Coast Salish, the range is from where I live, well into Washington State and over to Hawaii. So there is a significant overlap. And for northern British Columbia, you can see here, there's the Wet'suwet'en, and the work that I did was far north of the Coast Salish people. Now, part of understanding the context before I give you the case example, Canada is the only nation in the world that still has apartheid legislation. So Indigenous people in Canada are governed by federal laws. It's called the Indian Act of 1876. And it affects everything in terms of access to healthcare, funding for education, housing, drinking water. And really, there is rights and title differences, of course. But what remains interesting, again, is that when you look at countries around the world, Canada, the only country in the world with apartheid legislation. Within the context of health, studies have shown, and we understand, that there is a disproportionate degree of poor health-related outcomes amongst Indigenous people versus non-Indigenous people. For example, rates of food insecurity in Indigenous communities are much higher than the national average. When we look at mortality and morbidity, again, amongst Indigenous people, much higher compared to non-Indigenous people. We see more chronic health, diabetes, heart disease, asthma, cirrhosis. And often these chronic disease become very acute. And the acuteness of it, what research shows us is that due to the inability at times to access urgent care, things become from a chronic back to acute. So when you think of the overarching principle here, the decision-making processes that we need to shift to, and some regions of Canada are doing this, is recognizing the value of Indigenous self-determination through ownership, control, sovereignty, all that stuff. And also the principles of respect, trust, self-determination, and commitment. In general, in principle, most governments across Canada, in fact, all governments across Canada speak to that. In practice, there remains a disparity. So when you look at Indigenous mental health, in the area that I practice in, which is addiction, 60% of Indigenous people, even since COVID, have reported that their mental health is suffering. That's much higher than what we see in the national average as well. When we look at suicide, especially amongst youth, it's 5 to 6 times higher. And when you look at the extreme north of Canada, it's 11 times higher. When we look at our prison population, keep in mind, 4.6 to 6% of individuals are Indigenous. They make up well over 40%, 36 to 40% of the prison population in Canada. And in Manitoba, it's almost 50%. And the highest incarceration for women is being Indigenous. The other thing that has come to the forefront, and I've definitely experienced as well on reserve, is drinking water. 20% of First Nation communities to this day are still under boil water or drinking water advisories. And that's been consistent for over 25 years. So in the collective consciousness of Canada, there's been a push to resolve drinking water issues, yet we're still not there in 2022 for Indigenous people. What I've learned, and again, I'm not Indigenous, this is my learning. I've learned about traditional beliefs, and I've learned more about the knowledge of healing practices. And a decade ago, had you said to me, would you incorporate traditional medicine or healing in your work? I'd be like, I don't know. I don't know how. It's not what I was taught. And through my practice now, certainly over the last 5 years, 90% of my work is working with a client, but also 90% is working with an Indigenous healer. So I'll do the Western part of addiction or mental health, and then the real work begins with the traditional healer, and it's powerful. It's powerful to see that and experience that. So like I said, a documented disparity that exists from accessing health, mental health services, and it's quite extreme, especially the more north you get or outside of urban population. And we've made progress in the last 20 years, absolutely. But when we look at Indigenous children and youth and the burden of physical and mental health illness, in my experience, and it is well documented, that what we actually see is that there is a grounding within a systemic discrimination in terms of law and policy impacting Indigenous people. And many have been left to suffer from that in terms of access to mental health or access to health services. And there's also a historical trauma that I'm going to speak to in a moment. It's a very dark side of Canadian history. Some of my work is critical incident stress and critical incident response. And the team that I work with, that I lead, we're often called in when there's a significant event within an Indigenous community, some communities. We've seen an increase in the rate of mental health related incidents. And we've really tried to shift our practice. And although there's some evidence to support it, there needs to be a bit more study, again, in terms of how do we incorporate a Western model into an Indigenous way of being? And the answer is we can't, right? We have to reshift and rethink that in terms of how do we fit in terms of an Indigenous way of being? How do we fit? And how do we support? And how do we do that in a different way? You may have heard about the term residential school. It was a incredibly dark piece of Canadian history from the 1800s, 1860-ish, until 1996. It was an extensive system set up by the Canadian government, administrated by the church, the Catholic Church, the Anglican Church, where children were taken from their families, from their homes, and placed into a residential system by law. And there was this indoctrination where Euro-Canadian and Eurocentric Christian ways of living were placed upon Indigenous people, and they were required to conform. I have had the privilege to work with residential school survivors for many years. And the stories that I hear are very consistent in terms of the disruption of family life, the generations of impact, and the loss of traditional culture and language. So because people were removed from their families and they weren't able to speak their own language or practice their own traditions, there's been a well-documented, collective, cumulative historical trauma. And we see the impact of that today. Without any, I mean, to be clear, the purpose of the residential school system at that time was to eliminate all aspects of Indigenous culture. From having the child's hair cut to being placed in uniforms. They were often referred to by their number, not by their name. So residential school students, I shouldn't even use the word student. People who attended residential school, they didn't get the same education as the general population. Overall, teaching was focused on practical skills, and 136 residential schools were in operation in Canada over about 100 years, right? So Canadian law made attendance mandatory, and school administration became the legal guardian. So that's over 150,000 children were sent into this system. The abuse that we saw, or that they experienced, documented by police, perpetrated. RCMP were often the ones to take Indigenous children to the residential school. 90 to 100% experienced abuse. High degrees of sexual abuse, physical abuse, and of course, emotional abuse. And the survivors I work with, the story, whether I'm in the North, whether I'm in the South, whether I'm in Central Canada, doesn't matter. The experience, all slightly different. But the stories of abuse are all very similar. Very horrific, very horrific stories. So Canada did in between 2007 and 15 create what was called, or what is called, the Truth and Reconciliation Commission. And it was, the chair was Senator Murray Sinclair. And the commission heard over 6,500 witnesses. There were national events across Canada. And from that, in 2015, the commission released 94 calls to action. And of those 94 calls for action, many were related to health and social services. So you may have seen on the news, I know certainly on your major news networks, Kamloops, the Kamloops Residential School on May 23rd last year, 250 unmarked graves were discovered at that site. And my work now is I am one of the practitioners for the interior, where Kamloops is. I've been to that site. I've been with survivors on that site. And there had been rumors of unmarked graves forever. No one had really talked about it. And when you talk to survivors, most are like, yeah, we knew that. So all of a sudden, there was this shift in Canadian culture as it relates to understanding in a different way what the United Nations has called cultural genocide in Canada. Moving into today, another major issue that we are facing in Canada is the number of Indigenous women and girls who have gone missing. And the national average in terms of homicide and violence against women is highest amongst Indigenous women. And when you go to the north, one of the more sobering things that I certainly note is the billboards. And there's billboards of the faces of missing women. So as much as there has been some growth in Canada around acknowledging and understanding better this disparity, there's a lot of work to do. And this month is Indigenous Peoples Day in Canada on the 21st. And it's an opportunity for us to recognize and celebrate also the beauty and the unique heritage and the diversity and contributions Indigenous people make in our country. So I set this up in terms of how I entered the scene as it relates to the research I'm going to speak to, because I think you need that background, okay? You know this. In terms of how to create impactful research, I mean, it's critical, it's a tool. And it allows us to navigate our world, which is very complex, in a different way. So instead of relying solely on intuition or people's authority or luck, we've really conceptualized differently through the scientific method a way of seeing the world. Now, one of the harder things about research is trying to understand what you're going to study or what you are studying and the ethics around that. So when I was asked to step in as the interim health director in the North, not for the whole North, just for a section of the North, I did so based on relationships. And I was asked by a leader in community who I'd known for years to step in and see how health care could be delivered differently. And when I arrived, and I'm not going to say which area or which nation, out of respect, but when I arrived, there was one nurse for thousands of people. Physicians did not visit there. They used to. Mental health practitioner, there was one. And consistent delivery of health services was non-existent for the most part. There was also a drinking water issue. There was a clean water drinking issue that we had to address. So the more north you go, the longer the distance in order to get help, right? In order to get complex levels of care. So we had a really amazing team of people And we started to look at, okay, here's our budget that wasn't enough. And what service can, how can we do more with less? And I realized very quickly we were approaching that the wrong way. And we were responding crisis to crisis to crisis. So we started to construct a plan in terms of how could we deliver more sustainable care over a longer period of time in a more effective way. And then there was a suicide crisis. And that planning came to a screeching halt. And by crisis, what I mean is, and I've been a first responder for a long time. I attended 60 suicide attempts, not all successful, within 3 months. And in a very small community, we did not have the resource to deal with what was happening. We needed to ask for help, but it wasn't, hey, come help us. It was more, what resources could we tap into as a sovereign government, because that community is a sovereign government, in the best way they saw to address the problem. When we were in the throes of the crisis, and this lasted months and months and months, we built new relationships with government. We built new relationships with other providers, school district. But we also, there was a physician that I started to work with quite closely. Like, we need to measure what's happening. Now, doing that while the crisis was occurring, not only did we have we didn't have the resource, not exactly ethical, right? The thing about research, in my experience, and by the way, I was completing my PhD at North Central while I was in that role. And I actually defended up in the North. What my chair at the time, Dr. Stones, Dr. Serco, people that I still work with, and what I learned through the university was that research really propels us forward as humanity. And it's fueled by curiosity. And the more curious we get, the more questions we ask, and the more we're able to immerse ourselves in discovering what is happening around us. For me, that's very, it allows me to thrive. I love it, love it. Now, had you asked me in my master's if I wanted to do research, I would have said, no, good Lord, I want to be a clinician. But I've come to appreciate and understand the power of research. And when you think about it, even as a society, have we not been curious about the ends of the earth or the stars? We would still think the earth was flat. So one of the questions that we asked each other in the North, and the question that you have to ask yourself in research is, who cares? So what? So what? You have an idea. Good for you. What is the impact? What are you trying to answer? At City University, I have the pleasure of being the clinical attached to all capstones for master's students leaving in our clinical program, and out of Edmonton. And I ask students that all the time. They come with these brilliant, and they are brilliant. But being able to ask yourself, okay, so what? And then how do you stay motivated for a long period of time in order to not only select your topic, not only drill down into your question, not only the lit review, but actually compiling that data? It's brutal. It's supposed to be brutal because the impact of what you're doing is significant. So choose a topic you like, first of all. If you are not interested in it, do not do it. And when we were asking ourselves, okay, what do we want to look at here? And I'll explain what Jordan's principle is shortly. We really wanted to see, is there evidence out there that would support a more integrated system of care? Now we have to be careful with that concept as well, because that integrated residential school system was one of the most tragic, horrific events in Canadian history. And that's not what we were talking about. In fact, we even changed our language around that. But what we were looking at was how could we, in a very small, manageable way, contribute to the literature based on a crisis of suicide amongst children and youth that would impact policy, but also impact practice. So Hulley's work in 2007 around your topic defined it as finer, right? Is your work, it's like a SMART goal. Is it feasible, interesting? Is it novel? And a big piece of that is it ethical? And also, is it relevant? At the university where I'm a professor, I'm the Research Ethics Board chair. I really have a new understanding of the importance, not only of consent, but what we do with the data that we're managing. I know at NCU, you go through, you have a course and I did it, and you have your application and I did it. And I don't think I really appreciated at that time the significance and importance. And the reason is, when you're doing research in real time, some of the questions, some of your approach can actually harm someone. And how do you balance and mitigate that risk? Well, I'll tell you the first thing we did for 2 non-Indigenous people, we stopped what we were doing in terms of research, and we engaged Indigenous leadership. We talked to the chiefs, and we talked to the traditional hereditary chiefs, and we sought permission. But that didn't come overnight. We had been working for a very long time in this crisis and learning, frankly, as we went, making mistakes as we went, but also evaluating and measuring. So we asked for permission. We asked for permission to conduct research. We were asking permission to conduct secondary research. And you'll hear through research ethics, oh, you don't need ethics approval, right, for secondary research. Well, you certainly do when you're working with an Indigenous population. It's not only the right thing to do, it's the only thing to do. In our publication, and I'm moving towards walking you through it, setting the context. We didn't disclose the location of the work. We didn't. And we engaged a good friend of mine, Hereditary Chief Sandra Harris from the Gitxsan. She's doing her PhD at UNBC in trauma. And Jenny Thomas, a social worker from Cowichan tribes, neither one attached to that nation, or the area that we were working in, as collaborators. And then Dr. Stones, my chair, was one of the authors, and so was Dr. Phillips, a friend. In fact, one of my best friends who I met at NCU, and she was smarter than me, and she finished faster than me, her PhD, lives in Texas. I visit, and we have published many times together over the years. But understanding the ethical process within the context of culture and diversity, and how you approach that the right way, is by asking questions, right? Understanding the norms of the community or the culture, and seeking truth and knowledge to avoid error. And that starts with your topic. Because if you are working in a diverse population, there are steps you need to take to do things the right way. In broad strokes, Jordan's principle is from a child, Jordan Rivers Anderson, who, while government was trying to figure out, as an Indigenous child, when government was trying to figure out who would pay for this child with special needs, their care, months spent in hospital, and all this child and family wanted to do was return to their community, but no one could figure out how to pay for it. Jordan died in hospital. And that led to court cases. It led to the Human Rights Tribunal. And it looked at the, again, the extreme disparity in terms of mental health, special education, everything from dental care to physiotherapy equipment. And the Human Rights Tribunal said, Government of Canada, you need to pay for this. The Government of Canada at the time was saying, no, we're not going to pay for that. By the time 2017 rolled around, Jordan's principle was in force, meaning the first point of contact in terms of government that a First Nation would go to, was responsible for payment of a critical issue for a child. Now, it had never been applied to a community before. And that's what we were demanding, was that I can't attach the dollar per child, which they were asking for. Given the crisis, we were able to apply it for the first time and the last time to a community. So when we stepped back from that, we had an infusion of funding, but also an infusion of professionals. But it was all governed and ran by the chief and council and the hereditary chiefs. They guided us. And the crisis subsided. But we wanted to look at, to what degree, if any, is there a need for a national strategy around Indigenous child and youth mental health? And also, is there an opportunity for Jordan's principle as part of that incredible legacy? Is part of that a national strategy? And we worked on refining our question, and we sent it, or we approached the chiefs, we approached the hereditary, and we whittled down what we wanted to do. And then we started again, and then we went back and forth. And the questions were no longer ours as two non-Indigenous people. It wasn't. They were rescripted and restructured so that it was meaningful for the people that we were working with and for. So just want to write. So for the purpose of this study, we knew we needed to look at, can we confirm the disparity within Indigenous community around the issues that we're talking about? Well, yeah, there's a lot of research on that. Are we able to highlight child and youth mental health? Well, and yeah, mental health, yeah, we have to. And then could we look at Jordan's principle as an effective measure towards some sort of strategy? Because what we saw was that every level of government we went to, no one knew what to do. No one wanted to take responsibility, really. So when we began our work, and one of the outcomes of our work, we reconfirmed, like many other authors, the severe disparity existing in Canada for basic health and mental health services amongst Indigenous children and youth. And from our introduction, in terms of grabbing attention, in terms of laying out what we wanted to talk about, again, we went back to the Indigenous leadership. And from that, we learned what was important and what wasn't. And it's called a two eyes way of being in terms of research. And I'll talk about that. Your research, your literature review is really guided in terms of what your scope is, right? What are you trying to prove? Knowing that your whole job really is to prove yourself wrong. And then how to synthesize that in terms of separate elements to align and form a whole. Not easy, right? I have found in terms of publication and research, the more focused, specific, and smart you are around literally telling a story, a narrative, is how you contribute most effectively and powerfully to your work. I'll make this available after the fact, but I've included some steps that you might find useful. And I've repeated myself here, sorry. We began a critical analysis, and what we were looking at was, could we do an exploratory review of the literature to support the creation of something bigger? Okay, so we considered different opinion. We considered what literature we wanted to look at, and in doing that, how we did it, well, it included this 5C concept, right? We wanted to state what we wanted to do, but but we had to have it grounded and driven through the literature. There is a tendency when we're familiarizing ourselves with the existing literature and the debates in the field to become either overly critical or overly accepting of information. And these overgeneralizations tend to be one of the greatest factors that impacts what you're doing in not necessarily a good way. So including methodological limitations and asking yourself at every step, how well have we explained and defined what we're trying to do? And that typically involves talking to other people. So we looked at hundreds of articles, hundreds. And we had criteria within the last 5 years. We had the domains that we wanted to look at. But we wanted to go back in history. And again, it was really to reconfirm certain things that were truth, right? But then we also wanted to look at something new. What was Jordan's principle? And we needed to explain that to our reader. So whether you're a politician or a clinician, doesn't matter. You have the ability to understand in plain, simple language what we're talking about, right? When you explain the methodological approach, you're really looking at introducing your approach to research. How are you going to do it? How are you going to collect the data? Can someone replicate step by step what you did? And have you chosen a method, a theory that will guide your work to inform action, right? And you're really seeking to contextualize its findings, right? Within the larger body, your whole goal here is a very small contribution to the literature. So two-eyed research, it's an approach of inquiry, as you can see there. And it looks at looks through an Indigenous lens. Sandra Harris was the one that was like, we need to look at this approach to better understand through an Indigenous way of being what we're looking at. And it was developed from the teachings of Chief Charles at the Acadia First Nation. And I'd encourage you to look at it. And it really refers to learning to see from one eye with the strengths of Indigenous knowledge and ways of knowing, and from the other eye, the strengths of Western knowledge and ways of knowing. So really a hybrid model of understanding. So the method, like I said, we were looking at an exploratory process. We drew from some of my previous work, qualitative work. My PhD was quantitative, and I looked at workplace violence related to first responders and depression and the rates. And we found that the rates of workplace bullying and harassment are 6 times higher among first responders. And for my PsyD, for the clinical doctorate, looked through a qualitative lens using a hermeneutical approach, exploring the literature around sexualized violence at work. And we're able to draw from the qualitative piece that I'd done and look at how would we engage the literature through an acceptable method. And we were able to do that. And we did it through a scoping review. We looked at literature from Canada and the United States. And through the two eyes approach, we identified Mackenzie and Morissetti's community development principle, because we were looking beyond the clinical. We were looking at a larger policy. And so our theoretical framework, it looked at the Indigenous view, and it looked at a different worldview, taking the best of the Westernized culture, however, recognizing those limitations. And so when we collected our data, we looked at initially hundreds of articles. And from that, when we defined our terms and our databases, we ended up with about 92 articles. There were a bunch of conditions. It had to be within the last 5 years. It had to relate to child and youth Indigenous mental health. It had to qualify in terms of the validity and the strength of the article. And of those 92, we accepted about 58. Now remember, qualitative review, okay? So as we built our argument, we began to realize that a framework to a large degree, informed by the literature, kind of existed through the Truth and Reconciliation report of 2015. And we spoke to that. And in the articles that we were reviewing, the themes that continued to emerge were all apparently seemed to be linked, and then we proved that it was linked to truth and reconciliation. So we find evidence and themes to suggest there is a need for a national strategy, but we weren't able to identify how. We weren't able to identify how. We were able to identify the disparity of mental health and health services amongst Indigenous youth and children. We were able to identify Jordan's principle in terms of the application and the need for community application. So then what? Well, policy. So in terms of policy and practice, we're looking at how do we inform public health? How do we inform decision makers around the need for this engagement in a different way? And that wasn't easy, was not easy. Three different levels of government: federal, provincial, Indigenous, with not a very good track record working together, to be quite frank. But how could we, through our data, identify some of these critical problems? And then how does our work benefit the research? Well, following the footsteps of Truth and Reconciliation, we looked at, okay, what would our calls to action be related to mental health? And here's what the data showed us. There was a need for trauma-informed practice. Trauma-informed practice, and I'll come back to that slide, really looking at a strength-based framework grounded in the understanding and the responsiveness of the impact of trauma. Well, I told you about the Indian residential school system, and that is to a large degree what we were still seeing, right? Impacts from that. Then we went a step further and we asked the question, well, if trauma-informed practice seems to work, and any clinicians in the room, I think you'll agree with me, what about trauma-informed policy? Imagine for a minute creating a policy not through the lens of the law, but through the experience of the end user. And our data suggested that could perhaps be something that we needed to look at. There was a need for a national strategy and to engage through cooperation, coordination, and collaboration to meet the critical need that we were seeing on the ground in community. Part of our recommendations included, well, we actually don't have a solution in terms of what it looks like. We have the data to say we need a national strategy. And we talked about how do you plan nationally, but delivered locally, and that it must be Indigenous led. And how do we do that? We do that through reducing stigma, understanding racism and discrimination, and making safe this quality of care, which is central to mental health. I wanted to take a minute. This is a eye test. This is a vision test for you here. In 2007, when I was an undergraduate, way before 2007, and I finished my master's in 2002, Dr. Harriet McMillan, who is a renowned psychiatrist, Master University, I worked under her as part of the child abuse team and at the Dan Offord Center. And she invited me as a graduate student, sorry, not undergraduate, to contribute to her research. And so the first study I was ever part of, and you can see there, I'm like the 15th author, right? Like right at the bottom. She created this research around a development of a policy-related child maltreatment research strategy. Well, guess what? Fast forward from '07 to 2017, a big piece of the framework we use is what she taught me back in the early 2000s. So if you have the opportunity to work with a mentor, or if someone is willing to take you under their wing in terms of research, you'd be surprised what you draw on later. At the end of the day, we had a little bit of attention from the article. Interestingly, most of the contribution that we had and that we made seemed to be of interest to Indigenous governments in the United States. We spent quite a bit of time in your country speaking to this. And actually, a lot of pushback in Canada, a lot of pushback in terms of rethinking things. And it landed well with the people that we were working with, and it landed well in terms of the impact we were making for that community. But as a national strategy, as looking at things differently, did we make an impact? I don't know. And that's the funny thing about research. And when you reflect back, right, you're reflecting back on the work, you will find about a million things you would do differently. And when you're a student and you're working on your dissertation or your thesis, and you think it is, I did, the most important piece of work that you will ever do, it is not. It really isn't. It is the step to doing more. Okay, it's the step to doing more, and we can reflect and we learn. But really, research is about contributing and building for the future. And maybe 10 years from now, people will use that research that we did to rethink things. And there's really this need, this very strong demand of you as professionals in training and researchers in training to demand evidence and think critically. And I would encourage you in your studies, and I would encourage you in your career to go fail at something. Okay, like go fail, because you learn from that. Like the light bulb. Do you think Edison nailed that the first time? No, of course not. Hundreds of revisions. Now we have LED, thousands of revisions. So you can always do better in that piece. But when you are pulling it together in terms of the interpretation, the conclusion, the recommendations, your chapter 5, if you will, the purpose is, are you answering your research question? It is not the opportunity to be philosophical. It's not the opportunity to create all these futuristic ideas. You're literally asking yourself, did I answer the question? And now I'm going to speak to it. It is your opportunity to inform policy and to inform practice at that point. So my colleagues, Sandra Harris, Jenny Thomas, Miranda Phillips, Angie Stones, were instrumental in an opportunity to do research based on what I can say one of the hardest and more devastating experiences in my career. And from that, though, there was healing. And the most important part was learning about the importance of trust in the communities that you're working in, and understanding how to use this knowledge in a safe way, and also when it is inappropriate for you to do research. Now, to lighten the mood, I would like to let you in on some codes that you will hear from your professors, and I use them. It's what I see from you, various sources. Forgot the name of the authors. An extensive search often means a Google search. And impossible to summarize means I do not understand. So try and avoid that. This was my journey. I know it's the stages of grief. However, it was my academic journey. It is my career journey. And you know the beautiful thing of something messy? So you don't really know how it's going to end. And you have the ability to determine that. And I would encourage you to do that differently. I think this is funny, right? There is a long journey that you're engaging in for your study. It is a marathon, it is not a race. And if you have the opportunity in your career to look at a problem, apply research and method and theory, and come out with something that is sound, you've done well. So every lecture I give, everywhere, I always talk about three things. You have the ability where you're at in life to dream big. When you dream big, it allows you to be innovative. The second thing I ask from people when I'm working with them, do what's right, not what's easy. That is hard because we have this too hard to touch pile, right? We don't want to touch it. Your job as professionals in training is to learn how to touch that safely. And I would encourage you to do that. And also finish what you start. You have to finish what you start, your journey, and you will. So I have spent way too much time talking. So I'm going to stop so that we could answer some questions.
Thank you so much. Let me see here, Dr. Walker. I have a couple that I'm going to go ahead and start off with. And then,
no more questions.
And then for our attendees, please feel free to ask questions in the Q&A. And there's a couple things in the chat that I'll share. Can I ask, how were you first, when you were doing your work with the Indigenous groups, how were you first invited to come there? How did that unfold?
So in 2013, I had gone through a great deal of my own trauma, and I'd spent quite a bit of time working through some very serious mental health. And I came out positively on the other side of that. And I met a chief, Michael Harry, and I met him through a friend. And we were at a coffee shop in a very small town, and he's like, "Would you come and work with me?" I'm like, "No, no, I'm not gonna." And he's like, "No, but we want to look at welfare. Want to work at social programs differently." And he brought me in, and that was the beginning. And then I had female mentors, elders, who really launched me in terms of building trust and community. And at one point, I was the executive director for on-reserve welfare programs and services in BC. Yeah, that's how.
Okay. Okay, I was wondering how that, and then another, you touched on this in your presentation. Have you looked at comparisons of mental health and suicide rates or addiction rates between the US and Canada when it comes to Indigenous groups? I know you touched on it briefly.
Yeah. I have not, because most of my work is Canadian. However, I have a PhD student who is.
Oh, okay.
And she's looking at the Oklahoma Nation, I believe it's called. And what she's finding, again, is disproportionately high, of course, rates of addiction and mental health. And the comparison with Canada, it appears Canada's higher.
Okay.
Yeah.
Another question. How do Indigenous people access mental health care in remote areas? How do they get that?
So there's so Canada, socialized medicine, and I was saying earlier, like it might take me 18 months to get an MRI. But yeah, like we got $10 a month daycare coming and stuff like that. The system actually works. However, it is two-tier. It is two-tier. And Indigenous people, like I mentioned, and I don't speak on behalf of, I'm just sharing my experience.
Right.
The Indian Act governs that. The federal government determines the health funding, and it's completely inadequate. And Indigenous people, of course, have the right and the ability to access higher levels of care. And in community, sometimes there's a nurse, one for thousands of people. And for mental health, for instance, where I'm working in the interior, I can't even count the population. It's me for addiction, right? So it's hard. It's challenging. Yeah, it's very challenging. Yeah.
My goodness. Couple things here in the chat. Somebody mentions, thank you so much for sharing the context of our research and the in the broader context of real life. And I thought I would share that as well too. And then someone says, just a thought, sometimes the impact of research can be indirect. It can start important conversations that eventually should inform policy. So, so they're saying, so I wouldn't say that your paper had no impact.
Well, I know Dr. Fayez, and that was kind. The point I was trying to make was there is a vulnerability to publishing, right? You're putting your thoughts on paper, you put your words, your work, and it's actually the job of other people, other researchers, to figure out if you did it right. What I wasn't expecting was the political pushback. I didn't expect it. We were warned it might happen, but yeah, no, I'm not quite ready for that.
Okay. Oh, sorry. There's my dog making an entrance.
Of course.
As of right now, I don't have any other questions. I was just going to wait just another second to see if anything pops up in terms of framing. I did have a question about the C's. You had the 5 C's.
Yeah.
Are you able to expand on if that was for the particular set of research that you were conducting, or is that just a general thing that you do as a process?
It is a process I use overall, and it's what I teach my students around how to cite, compare, contrast, critique, and connect. And so it's a different way of understanding in terms of the information or the data that you're accessing. You're assessing quality in a different way. And I ask myself those questions for every single article I read.
All right, thank you so much. Okay, so without any other questions at this time, I definitely want to thank our attendees
Thank you
for being with us today. And if anyone does have any follow-up questions, don't hesitate to reach out to me at espranger@ncu.edu. I'm happy to pass those along to Dr. Walker. And thank you so much, Dr. Walker, for coming back,
Emily.
as always.
Nice to see you.
Nice to see you too. And I will note that someone popped in the chat. I learned so much from this. Thank you,
Cool.
Dr. Walker, for this presentation.
I'm sorry I talk so much.
And I'm glad that it's wonderful bits and pieces of talking. So thank you so much for sharing your knowledge with us and your process. It's going to help inform our students' research endeavors as well. So thank you so much.
Good. Thank you. Take care.
Talk to you next time.